It's typical for a patient to lose a tooth either from gum disease, a broken tooth, and the differences between someone's motivation to replace a tooth is either functional, meaning they want to chew better, and usually that's a back tooth, or cosmetic, and wanting to replace a front tooth. Typically, the advantages of a dental implant are that if you've lost a single tooth, you have a single tooth solution for a single tooth problem. So the process of getting a single tooth implant is very methodical at the dental specialist. First, we get you in for an appointment and a consultation, talk about what your goals are, what your needs are. Then we're gonna coordinate a 3D scan of your jaw to identify how much bone is present, to make sure that we're safely performing surgery for you, making sure that we're keeping out of the way of any vital areas, bone, any nerves, any arteries. After we make sure that everything is going to be safe, we get you in for the appointment and we make a small incision in the gum. We're then able to place this titanium pin below the level of the gum. In today's modern dental age, the only way to replace a missing tooth is with a single dental implant. It's streamlined, it's easy to accomplish, it can be a very comfortable process, and people have huge satisfaction over the outcomes and the results that they can get.